Thank you. Well, I would start out by saying if you ever offered to do something for Debbie Moss, you've signed up. Because I went up in front of the church, I think probably 10 or 11 years ago. I was going to Dawson at the time. I live in Vestavia now and attend another church regularly, love Dawson. But she was new at the church, and she was up front being announced, and she was the Minister of Health and Wellness. And I went up and I stuck my hand out and I said, I'm a dermatologist. If there's any way we can ever work together, you let me know. She let me know, because she's the one who put together the skin cancer screenings. And she's right. You know, sometimes we forget, because things on the skin are oftentimes pretty easy for us to take care of. There are absolutely skin cancers that kill people, and they do that not infrequently. I can tell you I've been in the clinic since 7 a.m. this morning, and you know what I've been doing? I've been taking care of a whole lot of skin cancer. I do that way more than anything else. And so we're going to talk about acne and rosacea and psoriasis and eczema, but we're also going to talk about skin cancer. I did not become a dermatologist to be a skin cancer doctor. I became a dermatologist because I had acne growing up. And the doctor who had such a positive impact on my life was the one who cleared up my acne. And I remember looking at him and saying, you know what, I'm going to be a dermatologist. And I don't think he believed me at the time. This was in Cape Girardeau, Missouri, where I grew up. I had the distinct pleasure, and it was such a fun moment, and I bet you guys have similar stories like this. About 3 or 4 years ago, because I started my practice at UAB on faculty at the university. And I've really tried to develop an expertise, in particular in acne and rosacea. That's what I write about. That's what I lecture about. I lectured in Brazil last year on that very subject. So this is something that I do a lot with. But he called me with an acne question. And I told him on the phone, I said, do you know who I am? Do you remember that I was your patient when I was like 17 and 18? And he said yes, and I don't know that I believe that. But anyway, it's fun when it comes full circle like that, and I bet you guys have some similar stories. I hated having acne, but now I'm so glad I did, because I have the best job in the world. You know, it's amazing how things like that can work out. She probably hates having acne too. I don't know, can you guys see that okay? Does it show up okay? All right, we're not going to spend a ton of time on any of these. There is a wealth of knowledge that exists about acne in the medical literature. Now, the amount of information you're going to get if you pick up Woman's Day or Glamour magazine, or what are some others that we could list? You know, the young girls who may be picking up 17 magazine to get their acne information, it's going to look really, really different, okay? So what does acne look like? Acne can be mild. It can be horrendously severe. Acne can be so bad that it causes fever. It can be so bad that it causes arthritis symptoms, okay? We don't always think of that. And that's the extreme. Most of the time we're going to see something like this. This would be a person, if we could see this up even more closely, the prototype lesion of acne is the blackhead or the little bitty whitehead. Now, we're going to talk in a minute about rosacea. Rosacea does not have blackheads. So if you're trying to decide, what do I have? Do I have acne or do I have rosacea? If you've got blackheads on your face, you've got acne. If you don't, then you probably have rosacea, because otherwise the two can look a lot alike. She may be greasy. She may have a tender knot that comes up from time to time that hurts. Do you think she's bothered by this? Yes. It's real interesting with rosacea. The National Rosacea Society did a study, and they took pictures of people who did not have rosacea. And then, because you can do things like this digitally now, they digitally superimposed rosacea on top of the normal picture. And then they went out and they asked people different things about this individual, and they didn't know who they were seeing. So they would see some normal pictures, and then tucked in the deck, they would see the same person with rosacea. And they were ranked lower on things like, is this person successful? Is this person friendly? Is this person in a relationship with a significant other? Simply by adding bumps on the skin digitally to a picture, they were rated lower on all of those things. And so we get a little mad in dermatology when somebody says this is cosmetic. That makes me mad just to say it. This is a skin disease that deserves to be treated. And we have to work a little bit sometimes with insurance, keeping this out there as this is a skin disease that, although it's not life-threatening, this is very life-altering for people who have it. They spend extra time covering it. They wear their hair different. Boy, we watch teenagers come in with bad acne. You know, that really, really bad acne. You see it You know, and it's hard as the doctor. I might be in the drive-thru somewhere and the person checking me out has horrendous acne. No, I don't give them a card. Maybe I should, but I just think, oh, I wonder if you know what we could do about that. When I will stop you is if I think you have a melanoma. I've done that one time in an airport. I was sitting behind somebody and I could swear on the back of that head was a melanoma. And I tapped him on the shoulder and I just said, that needs to be seen. But I won't do that with something like acne. But the take home here is, this is bothersome and it deserves to be treated. It's most common during adolescence, okay? And adolescence is starting earlier now. I saw a young girl in clinic this week who was 10 years old. She's already started her cycle, okay? This is happening younger and younger. And she had a face full of acne. Some of our acne medications are FDA approved to the age of 9. So this is not something that just hits when you're 13 or 14. We're seeing this at younger and younger ages. The men grow out of it. Do the women grow out of it? Not nearly as much. We did a big study when I was on faculty at the university. We went out into our Kirkland Clinic waiting area and we surveyed 1,000 people, a little bit more than that. And we asked them to recall having acne at different times in their lives. And men and women would recall having it the same when they were teenagers, and that's probably true. But in the 20s and the 30s and the 40s and even the 50s, women reported having a lot more acne than the men. And we don't fully understand that. But we do know that adult female acne seems to be kind of its own entity. And do you think that bothers people? Yes. Yes. It's kind of, my analogy there is when you are 13 and you need braces, you put those silver braces on and you smile real big and you got those bands going around them and you've picked your Auburn or your Alabama colors. And what 30-year-old woman does that? You know, she gets Invisalign or she wants those clear braces, and it's the same thing with acne. So having acne as a teenager is not fun, but half your friends have it too, probably more than that. Having acne as a professional adult woman is not cool. Okay, I think what's important to note here, the second bullet that I put up there is, I'm getting borderline scientific on you, and I don't want to do too much of that. There are 4 things that we think work together to cause acne. One is oily skin. One is plugging of the hair pore, and that's with dead skin. The third is that there is a bacteria, but it's a bacteria that's really on all of us. Some people seem to mount more of a response to it. And then the fourth is just inflammation. Okay? I won't spend any more time on that, although we could spend a lot. What does not cause acne? You don't have acne because your skin is dirty. One of the most common things we see, people come into clinic and somebody who really is loving on them, they mean well, they say, you're not washing your face enough. You need to be scrubbing it more. You need to be using some alcohol. See, when you use alcohol, it's still brown. No, wrong, okay? You don't have acne from being dirty. And in fact, you can overwash your face and make acne worse. It's because you eat pizza or your diet's not good enough. The food is too greasy. Unless you're rubbing the French fries all over your face, they are probably not causing your acne, okay? And probably Coca-Cola's not causing acne. Now, sometimes I'll look at mom or dad in the room with the child and I'll be like, I gotcha. I don't want you eating those French fries. You know, you need to be drinking water. That's a biggie. Everybody comes into my clinic and says, but I drink a lot of water. Well, your kidneys really appreciate that. Your skin, you'd do better off to sit in a bathtub, right? The correlation of that is, if you're thirsty, do you go sit in the bathtub? No. And so you got to think here. Water is great, and I think we should all drink, you know, how many? 64 ounces of water a day. That's great for you, but that's not going to change acne appreciably. There's some new, chocolate does not cause acne. Now, there's some ongoing research. We're always looking at this in the field of dermatology. There is some research out there that maybe eating, again, here it comes again, a high sugar diet may in fact cause inflammation, which could in fact make acne a little bit worse. That's the one thing we're starting to see a little bit. And so I have no problem looking at anybody, any teenager, and saying, watch the sugar, okay? But I'm not going to say, don't ever have a Coke, don't ever eat pizza. That's not true. Don't eat ice cream? Number one, I wouldn't have very many patients. So here's just some easy tips. If you know somebody who has acne, if you have acne, number one, treat your skin gently. You didn't do anything to get the acne. You probably can't scrub it off. So cleanse, you know, use something gentle. Avoid scrubbing. this goes for all of us. It doesn't matter what kind of skin you have. Don't use real hot water. If it's real abrasive, don't use it. You don't need a washcloth. You don't need to polish it up. Fingertips, warm water. Gentle, 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 okay? You don't need alcohol. Yes, if you do this enough with alcohol, you're going to take some skin off and it may look brown. Don't over-cleanse. We're a little bad about that in the society that we live in. Don't overdo it. Gentle, gentle. First-line treatments, if you don't have bad acne and you want to try to manage this on your own, there's some good products over the counter. You're going to basically be looking for 2 or 3 ingredients. One is benzoyl peroxide. It's out there everywhere. Just remember, benzoyl peroxide. What do peroxides do sometimes? They bleach things. They can bleach all your pretty hand towels and your pillowcases, so do be careful with those. Salicylic acid is another good choice. It's a little bit of a peeler. Now, real high strengths of salicylic acids are what's in wart removers and callus removers, okay? And that would be like a 17% or a 40%. A really low percentage, like a 0.5% or a 2%, causes just a little bit of exfoliation. Okay, so there's a big span. We can take a really strong salicylic acid and turn it into a chemical peel. Salicylic acid, what does that remind you of? Is there another word that reminds you of? How about acetylsalicylic acid? Aspirin. So this is related to aspirin. It's also from the bark of the willow tree. And so some people like to use things that are all natural. Well, you can say that salicylic acid is an all-natural product. Another all-natural product that might help a little bit is tea tree oil. I don't love tea tree oil as much as I love the other two, but it is it's a reasonable option if acne is mild. I'll take 1 second to pause there and say, you know, another thing that we hear all the time in clinic is, but Dr. Harper, this rash cannot be from X product because it's all natural. Well, think about that for a minute. Is poison ivy all natural? It is all natural. And so there are tons of plants and there are tons of essential oils and there are tons of things that are at Whole Foods that are great for you that you can still have an allergic reaction to or have a negative reaction to. So just know that. Organic and all natural does not translate into not going to cause any problems because potentially they can. This is a big one for me. Number 3, I have to spend so much time with even my prescription acne patients. What people want to do, and I remember doing this as a kid, is you want to take your acne medicine and put about 10 coats right on the zit that you have at the time. And you go to bed with this little white blob on the... Don't do that, okay? Don't spot treat. Number 1, what we're trying to do with acne is not clear up what we have only. We want to do that. We want to move into prevention mode. So anytime a person is treating for acne or rosacea, you're treating the whole affected area every time you treat because you also want to be preventing acne. And be patient. This is so hard. You know, does anybody here do Amazon Prime? Somebody laughed. I know you're doing it. So if you like to shop online or if you even get your music or your movies online, if you sign up for Amazon Prime, and this is not a commercial, I own no stock, you don't even pay shipping, okay? So you pay too easy now. So all of a sudden, I need something. And I can go on Amazon Prime, and I can order it with 1 click, and it's at my house the next day. And I didn't even pay shipping. My reason for saying that right now is people think everything happens fast now. Do you know how long it takes to make acne better? 2 to 4 months. Okay, so I saw kids this morning in clinic who I started on brand new treatment, and I said, at Thanksgiving, you're going to be so happy with this. And, you know, at first they're like, school starts in 3 weeks, 4 weeks. You should have come in earlier, okay? Because this takes time. Now, you'll be better in 2 or 3 weeks, but you're not going to go from 80 pimples to 2. You know, it takes 4 months to make acne significantly better. Now, this person does not have acne. What do they have? Rosacea. And I put 2 different subtypes up here. There's actually 4 types of rosacea. This might surprise you. So there's red-faced rosacea. There's no bumps, sensitive skin and red face. They're, you know, every time they have a picture made, they're like, why is my face red? There's the medical term for that is erythematotelangiectatic rosacea. It took me a while to learn how to say that. The subtype over there is papulopustular rosacea. So now that's the bumpy rosacea that kind of looks like acne. There's also phymatous rosacea. So think of the bulbous nose. You know, when you see that, that's rosacea. That doesn't happen very often. And when that does happen, it's always in men. The women seem to get a pass on that. And the 4th type is ocular rosacea. You can have rosacea in your eye. And we think about probably 30% or so of people who have rosacea on the skin also have it in their eye. And they don't know that. They don't come into me and say, you know, I've noticed this in my eye too. They think they have allergies. So I have rosacea here, but my eyes are itchy, so I'm taking Zyrtec or whatever it is. A lot of times it's rosacea in the eye too. So it's characterized by three things, and it's always down, or most of the time down the middle 1/3 of the face. So these people have redness on the nose, the cheeks, the chin, the forehead. They have little broken blood vessels, and they can get bumps too. Okay, so that's typically what this looks like, and I kind of already said everything else here. So what are some tips here? Number one. Usually people with rosacea have some triggers that make it worse, and that trigger can be number one, and there was a big survey done through the National Rosacea Society. The number one trigger factor is, anyone want to guess? Sunlight. Exactly. Sunlight was number one. So wear sunscreen. But other things that are on the list are emotional stress, heat of any kind, drinking hot coffee, drinking hot tea, soup, spicy foods. You know, so many people worry that people are going to think they're an alcoholic if they have rosacea. Yes, alcohol can be a trigger in some people. It didn't cause the bulbous nose, okay? It doesn't, and still people want to link those things together. It is one trigger. It is not the trigger. So that is not a sign of just the drunken, what do they call that, like the drunken face. It's kind of sad for people who have rosacea, because frequently people will come in and say, I don't even drink alcohol and I still have this. There are lots of other things that can cause this. Avoid irritation. This is even more important in rosacea than it is in acne. So nothing that has a scrub. Here I would say no salicylic acid, no benzoyl peroxide. Those things are too irritating for rosacea skin. Moisturize, moisturize, moisturize. Repair the skin. Sunscreen every single day. Here I'm a little quicker to move on to prescription products too. There are some topicals that are on the market that are calming, and usually they're going to have like licorice extract in them. Again, maybe tea tree or green teas, things like that over the counter can benefit people. I would put sunscreen way up on this list. Niacinamide is another natural product that can be on this list, but frequently we have to go to either our topical prescriptions like topical metronidazole, topical azelaic acid, which you may know under the name of Finacea. There's a new one out, topical ivermectin, and the brand name for that is Soolantra, and all of those are FDA approved to treat rosacea. Sometimes we have to use antibiotics as well, systemic antibiotics, not because this has bacteria. Rosacea does not have a bug. This is not in any way related to bacteria, but those antibiotics are also very anti-inflammatory. Rosacea hits an older age group. It's important to know, though, here, whereas a lot of people with acne will outgrow it, most of the time you don't outgrow rosacea. So whatever you're doing to make it better is going to have to move over into a maintenance phase. So once you get it better, you're going to have to stay on treatment to keep it better. That's a little bit blurry. Can you see that okay? So dermatitis. Now, dermatitis is one of the most common things I see in clinic, but you need to know that dermatitis equals eczema. We do say eczema, not eczema. We won't laugh at you if you say eczema, because most of the lay population says eczema. That's fine. We know what you're talking about. Those two words mean the same thing. They just mean inflammation in the skin. It would kind of be like saying, I have a runny nose, okay, or rhinitis. Well, hanging under that, why do you have a runny nose? You're allergic to something, or you have a viral infection, or you have a bacterial sinus infection, or okay, same thing with dermatitis. Why do you have dermatitis? You could have atopic dermatitis. You can have something called asteatotic eczema. That means your skin's dry and it gave you eczema, okay? You can have nummular eczema, and I'll show you a picture of that. That means little coin-shaped areas of eczema that the whole world, if you're not a dermatologist, thinks is ringworm, and it's not ringworm, okay? You can have allergic contact dermatitis. That's like poison ivy. So there are lots of different reasons to have eczema. This is atopic dermatitis. These kids are born with sensitive skin. This is the kind that we see in the little bitty babies, and they have the little cracked cheeks, and they get, you know, rashy everywhere, and they itch once they're old enough to have an itch response, because when they're little bitty, they're not coordinated enough yet to scratch. So they have to pass a certain age point, and then in the bed you'll see them starting to scratch and itch. We call this the itch that rashes instead of the rash that itches. So itchy skin, and so sensitive. Things that would never make us itch would make somebody with atopic dermatitis really, really itchy. There are 5 things to take care of atopic dermatitis. I bet I tell somebody this every day in clinic. There's 5 steps. One, avoid things that are irritating. And unfortunately, the person I'm thinking of that I saw earlier this week she was probably 14. And the first thing out of my mouth was, if it smells really good and you got it at Bath & Body Works, you probably don't need to be using that, okay? Now, that's not for everybody in the room. If you don't have sensitive skin, knock yourself out, you know, go for it. But if you've got eczema-prone skin and it smells real good, or it lathers up real good, or it bubbles real good, you don't need to be using it, okay? Sorry. I know that's not fun. Laundry detergent, you don't need to be using Tide or Gain, or you need to be using Tide Free. All free and clear, something that doesn't have those fragrances in it. You don't need a dryer sheet ever if you have this, okay? Ever. If you need a fabric softener, you use something that you can put in the wash. And here I'd rather you use something like Downy Free. And I don't care what brand, but I'm talking about the free part. That means it doesn't have a lot of extra fragrance, doesn't have a lot of extra preservative. It's meant to stay in the clothes. That's how it works, okay? The second thing you can do here is double rinse cycles in the laundry. So if you're real sensitive to that, set your washing machine, if you have one that will do it, to do a double rinse. Also, save money. If they tell you to use a capful, use a half a capful. Okay, so use less than is recommended. That's all number one. Step number two is moisturize. When I talk to parents of babies with eczema, I say, I want this baby so greasy that when you hug them, they either shoot up to the ceiling or squeeze to the floor. You know, it's like a greased watermelon. Greasy, 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 greasy. Some of my favorite moisturizers are like CeraVe, Cetaphil Cream. Eucerin is a great product, and I'm leaving so many out that are so good. You do want things in jars most of the time if you're eczema prone, because jars are going to be thicker, okay? And they're going to be a little more occlusive on the skin. The best time to put a moisturizer on is within 3 minutes of getting out of the shower or the bath, okay? You do not have to skip your shower or bath. Every now and then that comes up again in the media. You can take a bath every day. You can give your baby a bath every day. Just don't use irritating soaps in the places you don't need it. And we all know where I'm talking about. You don't have to use soap. There are places you need to use soap, you know, armpits and the groin, and use the soap there. If you're rashy down your legs aren't getting that dirty. Don't suds them up. Okay, so some of that, again, gets back to the fact that we over-clean and we over-dry our skin. But you got 3 minutes to get your moisturizer on after the shower or the bath. Okay? Topical steroids. You can get just 1% hydrocortisone over the counter. That's what's available over the counter, is just 1%. If that's not enough, then go see a dermatologist or your primary care or whoever you see and get a prescription strength topical steroid. You don't want to use those on and on, but you can use them on the itchiest places when you need it, kind of as a rescue treatment. Occasionally, the last two are needed if eczema is bad, and that would be an oral antihistamine like a Benadryl product or something like that, especially the ones that make you sleepy. We think that's part of the way they work, is that they're a little bit sedating. But you have to be careful if you take those. You don't want to be driving a car or something like that if you're on an antihistamine that's affecting your cognition and your awareness. And lastly, antibiotics. And this is more important in the little kids, because when they start scratching, then they get impetigo. Not infantigo, impetigo. So it's spelled I-M-P-E-T-I-G-O, impetigo. And it is usually caused by staph or strep, and it will set up shop anywhere where the skin is broken, okay? And what it looks like is that yellow honey crust over the surface of the skin. And our little kids with eczema are very prone to getting that. By the way, staph freaks people out. We see it every day. If you have a sore in your nose and it is tender all the time and it doesn't ever want to go away, you probably have staph living in your nose. Now, some staph in your nose is fine. Okay? I know that sounds weird. It's okay. But if it's causing a recurrent sore, if every time you touch your nose it's tender, you probably should go see your doctor for that and get that treated, because that is now a source where if you get a rash somewhere else, you can infect yourself. Okay? Very common. This is the nummular eczema I was talking about. So people come into clinic, and a lot of times they've gone to their primary care. No knock on them. I'm a really horrible cardiologist. They come to us and they say, well, we got some ringworm medicine and it's not helping. Well, it's because you don't have ringworm. So ringworm is annular. Annular means it's a ring and the center is uninvolved. This is nummular, which means it's coin-shaped, and it's solid, almost always on the lower extremities. More common as we get older. This is all about having dry skin. Okay? Most common in the dry winter months. and that's when we have low humidity. It is hard to imagine having dry skin this time of year, but we do because we live inside and we use air conditioning and things like that. So, if you're not around humidity, this can be a problem. You do want to make sure, just some tips on this, again, that you're moisturizing within 3 minutes of getting out of the shower or the bath. Eliminate anything that's also causing dryness on the skin, okay? One of the biggies is you're freezing cold, so you sit right by the space heater, and the space heater blows right on those little shins, or maybe you drive a lot and the heater's where you got it turned up on those feet, or you sit by the fireplace. Anything like that that's going to dry the skin is going to contribute to this, okay? The other thing we also see with this is people self-medicate. So they get this, and by the time they come to see me, they have used, let me name some, A&D, Neosporin, witch hazel, alcohol. Well, of course you have a rash. If you're putting everything on this, and I'm not saying any one of those things is bad. My least favorite out of all of those would be alcohol, just because it's so drying. Pretty much there's not anything I want you to put alcohol on, okay? Except, if you're cleaning a needle or if you're cleaning your thermometer. Those things are fine, but on your skin, that's not your best choice. It's just so drying. So I would avoid that. Neosporin is another thing in that list I don't love, because we think up to 1 out of every 5 people become allergic to Neosporin. So you're going to see most dermatologists steering you toward polysporin. We like that product a little bit better than Neosporin. What is this? Blisters. What else? Somebody said it. I think somebody said it. Poison ivy. Poison ivy. Mm-hmm. Now, that's an easy diagnosis for us. There's a big take-home message here. Internal diseases do not put lines on the skin, okay? If you think about it, if you've ever had a rash from taking an antibiotic, for example, or if you've ever been unlucky enough to have hives, those are big old whelps, and they're circles, and they're diffuse. If you have a scratch like that, it's an external source, almost always, like 99% of the time. So you can look at this right here, and it's linear, and you say, oh, you've been out in the yard working in your flowers. Now, the first time you have poison ivy, you won't get the rash for 1 week. There's a 7-day delay the first time, okay? And that trips everybody up. You can go through life and never be allergic to poison ivy, and at the age of 70, become allergic to poison ivy. That is not uncommon, okay? So don't think, oh, I'm not allergic to that. I sure would not go out and rub it on you just to see, because that may be your day. But the first time you become allergic, there's a 7-day delay. After that, your immune system has been educated, and now it will take 24 hours. So the next time you're exposed to it, within 24 hours, you've got the rash. Some important things to know about allergic contact dermatitis from a plant. This is not contagious. I could rub right on that, and I'm not going to get it as long as the patient has showered. It's a resin from the plant that has to be on the skin. Okay? So you can scratch here and then scratch here, and you're not going to spread that. Now, what you could do is you had on your gardening clothes, and you had put them in the laundry, and you didn't know you got into poison ivy, and they're all over that clothes. And you go to pick those clothes up, and you just re-exposed yourself. Or you have a cat or a dog that is out through the yard all the time, and that cat likes to get up and snuggle on you. You just re-exposed yourself, but you're not going to be able to do it from doing that. Okay? Here's our guy. What is this? Also allergic contact dermatitis from nickel on the back of a snap. Get some new blue jeans, okay? Or truly, when we see this, and we see this a good amount, because this is the same kind of thing you'd get if you have jewelry allergy. If every time you wear something that has that little metal snap on the back, you can react like this. And so people will sew little patches over the backs of their pants. So you can do that. Sometimes it's from a belt that just sticks up just enough over the pants, or maybe the real problem is that our abdomen sticks over the pants, whatever it is. There is contact with the nickel, and it will cause a recurrent rash like this. So these are fun rashes for us to see, because it's all about, okay, this is localized in a weird place. What's coming into contact with that? We'll see this same kind of rash if people carry their keys or their change in their pocket. You'll see, why do I have a recurrent rash just on my right hip right here? You're allergic to nickel. And maybe you need some new britches because you got a hole, or they're really thin right there and it's going on through. Okay, so psoriasis. This is in my family. We think about 50% of the time this is inherited. 50% of the time it just comes up brand new. Psoriasis is different from eczema. Some of the treatments are the same, but psoriasis has this thick silver scale on it that you see at the top. And one difference between it and, let's just look at this. Let's go back and look at one of these. Oops, I'm showing you all the good stuff. Let's look at some of these eczemas. Okay, look at this. Could you take a pen and draw a real clean circle around this? Not exactly. See how the edge kind of feathers out of each of these? Well, that's not the case with psoriasis. Usually psoriasis has a really strong mark at the edge, you know, right where it starts and stops. Can you see that a little bit? Psoriasis loves the scalp, and people hate it on the scalp. This is something that really bothers people. Elbows, knees, fingernails, joints. If you've got psoriatic arthritis, go directly to the doctor, because that kind of arthritis destroys joints, and once they're destroyed, you can't get them back. That's not true with wear and tear arthritis. It's not as destructive. But this one, if you have arthritis with it, it's the arthritis that has to be treated pretty early on. So dry, red, and scaly plaques on the elbows, knees, and scalp, sharply outlined, inherited about half the time, and can be associated with arthritis. See your doctor. Like I said, see your doctor on this. You're going to probably need more than just moisturizer and 1% hydrocortisone, although those are reasonable places to start. For the scalp, something like a Neutrogena T-Sal, because it has salicylic acid. Okay, that's what T-Sal means. What did we say salicylic acid does? It peels and it sloughs. So that's a good shampoo for people with a lot of scale on the scalp. T-Gel shampoo relies on a tar-based product that's anti-inflammatory. Stuff like Head & Shoulders has pyrithione zinc in it, which is anti-inflammatory. All of those are good. Kind of depends on what you're trying to do. But the T-Sal or something with sal acid would be the best to kind of peel this off. This is the only place in this whole slide deck you'll hear me say, careful sunshine can really help psoriasis. If you sunburn psoriasis, you will make it worse. But we even send people sometimes, believe it or not, and we're at our roots so against this, we'll send them to a tanning bed or tell them to get outside and get a little bit of sunshine, because it will make this better. Now, are you putting yourself at increased risk of skin cancer? Yes, you are, but it's all about balancing risk and benefits. This is the risk, okay? I love that picture. It kind of makes me giggle. I hope that's a made-up picture, by the way, but it may not be. Let's talk about the sun. You guys doing okay? You staying with me here? This is the thing that I least want to see in clinic. This is what kills people. And this is, I think at our Dawson skin cancer screening, we probably have found at least one of these a year. This is malignant melanoma. This is the bad guy. This is the one that can, and I have somebody in my practice right now that this is in that person's brain now. So this spreads to other parts of the body. And so, you know, it's something that maybe to you doesn't look all that bad. That doesn't have to be big in diameter. It can be small. But these can be really aggressive. What you look for when you're looking at your moles to try to decide whether or not that's a bad one and it needs to be seen. First of all, if it crosses your mind, is that a bad one? Does it need to be seen? It needs to be seen, okay? Because with skin cancer, if we get to these early, we cut them off and we're done. It's the ones that sit there and go undiagnosed that can spread to other parts of the body. So early diagnosis is really important. We talk about the A, B, C, D, and E's. A, asymmetrical. We want these to be nice and smooth and mirror image, like you could fold the mole in half and it would be the same. So if one side's real jaggedy and the other side is smooth, I'm going to cut that off, okay? B is border irregularity. We like a nice smooth border. We don't want the jaggedy coast of Maine, okay? Smooth borders, good. Jaggedy, not good. C, color variation. Black is not necessarily bad if the whole thing is black. What we don't like is it's kind of black here and then kind of pink here, maybe white in the middle. And I hate to tell you this because these are the ones that scare we dermatologists to death. Some melanomas have no color at all. And those, I'm afraid we're missing some of those. They're called amelanotic melanomas. It means they're melanoma that have no pigment at all. Diameter bigger than 6 or 7 millimeters, that's the size of the end of a pencil eraser. If it's bigger than that, we're going to be more concerned, but melanomas start smaller than that. Most melanomas are going to come up brand new. meaning it's not a mold that's been there forever that has changed. That's probably about 40% of the cases. So it can be that, where you've got a mole, all of a sudden it's got a new bump in it. I would be interested in that. But most of them are going to come up what we call de novo, meaning they just come from nowhere and they're a brand new spot. These again are more examples of that. I just wanted to show another picture. And I'm pretty sure I biopsied one of these yesterday, and it was on the scalp. Women, the most common place we see these is on the calf. The calf. And I preach a lot about, I'm not saying any of you are like this, but from a vanity perspective, we start sun protecting up here. And I see this all the time. My makeup has sunscreen, my face has stayed good, but my little legs get toasty brown every year because my spider veins look bad. We have to sun protect our legs too, because in women, that's where we see it. We do see this in darker skin types. If you are African American, or if you are Asian, or if you are Hispanic, where people get these is under a fingernail. That's a very common place. So in darker skinned people, and who's the reggae guy? Bob Marley. This is what he died from. He had melanoma under a nail. And so you can get them there. And those are scary lesions when we see those. This happens to anyone. I have a patient in my practice right now, and I did not diagnose this. It was diagnosed by her gynecologist, but she has vaginal melanoma. You can have melanoma in the back of your eye, in the iris. So there are lots of places this come up aside from the skin. The skin should be the area that we can monitor for. This should be the area that we can watch for. Just an example. So you see something like that. It's got a little pink on the side, and we decide to take it off. And this is not necessarily what this case is. And lo and behold, it's a melanoma. Now what do we do? This is, and I'm sending a person for this right now. I just got the message. When I have a big melanoma, I send them down to UAB and have surgical oncology help me get them off. And they do something called sentinel lymphoscintigraphy, or sentinel node biopsies. So what this picture is showing, that's the blue in the middle is not the melanoma. That's a dye. And so they've gone right on top of, this would be a big melanoma. And they've gone on top of it and they've inked it. And what they're going to do now is they're going to use a technique to see where does that ink go, okay? What lymph node does it go to, okay? Because we want to know now, has this spread somewhere else? And so the dye, they will chase the first lymph node that dye goes to, and they will biopsy that lymph node. That's called a sentinel lymph node biopsy. If it's negative, you kind of feel better. It's not perfect still, but you kind of feel better that this is isolated. So one thing you might do is have a sentinel lymph node biopsy. I threw this in. This is what you don't do, okay? Now some people, what I want you all to do, and it doesn't matter what kind of skin type you have, sunscreen every day. Yes, every day. And that is on exposed areas, face and neck, backs of the arms and hands. If you can do that much, you're great. One sunburn increases your risk of melanoma. One time in a tanning bed could increase your risk of melanoma by up to 40%. Okay, I went to the tanning bed when I was in high school. I have not always been a dermatologist. That hurts my feelings now that I know what I did. But sun protect. Do not have another sunburn in your life. This is not worth dying for. This is a tanning bed. Do not go to the tanning bed. And we've got legislation out there now. It's getting harder and harder for minors to get in a tanning bed. And I'm so thankful for that, because unfortunately when we do a lot of this damage is when we're teenagers. Okay, so this is a squamous cell carcinoma. These also can be very dangerous. I can think of one precious patient in my head right now that did die from a squamous cell about in this location. It was left there, it came back around the nerves in the face. She looked like she'd had a stroke because the skin cancer in the nerve made the whole side of her face drop. And then it got into her parotid gland, and eventually she died from squamous cell carcinoma. These are from sun. Melanoma is probably from intermittent sun. It's the white-collar person who is not in the sun, but twice a year they go to the beach and they get blistered, okay? We kind of think of that as melanoma. That's not perfect. Anybody can be at risk for that. Squamous cell carcinoma, I play tennis every day. I play golf every day. I don't need sunscreen. I tan so easily. I'm a roofer. I work in construction. I love to work in the yard. No, I don't wear a hat. That's squamous cell carcinoma, okay? I see this multiple times a day, every single day. This is, I know, I almost didn't put this slide in there because this one's a little gruesome. I made my children look at this last night. They're 9 and 10. Because I'm like, this is why I'm telling you to wear sunscreen every day. I'm not, my mom used to say this about the good Lord. She'd say, The laws that God has set for us are to keep us safe. Oh, we say that to our kids as mamas all the time. Wear your sunscreen. It's not meant to be torture. It's meant to not let you get a skin cancer. And so this is a squamous cell carcinoma. And if this would have been caught earlier, it would have been a much smaller surgery. Basal cell carcinoma, this is the most common one. If you had to pick, you'd pick this one. This is the nicest of all of them. You know, when I see these, in fact, sometimes I worry that I'm too casual with my patients because I see these so often. Sometimes we can treat these with a cream. There's a cream FDA approved to treat these. But they are cancers and they need to be taken off. They look pearly like this and kind of shiny, and they have those little blood vessels in them. This, can you see the basal on the side of the nose? Basal cell carcinoma. Now when you see that, people, and there may be some people in this room I've had to work on a little bit. We won't call out any names, but when you see these, you don't get to just take off the skin cancer. The standard is that we measure at least 4 millimeters on each side. We cut that whole circle out. Circles, if you try to close them, here, who does crafts or sewing here? What would happen if I tried to take the 2 sides of that circle and pull it together? I'm going to have big puckers at the end, right? And so all of these circles have to come out in a football shape or an ellipse. And so the scar is going to be bigger than you think, always. Most important slide I'm going to talk about today, we're almost done. Sun protection tips. Wear sunscreen on exposed skin every day. Your minimum number is a 30. SPF 15 is not enough. Do a 30. And this is for all skin types again, too. Our darker skinned patients need sun protection every day. Broad spectrum, what that means is it's going to cover UVA and UVB, not just UVB. UVB is what makes you sunburn, but UVA is an important player, too. This is the hardest one. Reapply every 90 minutes to 2 hours. My golfers, when you get to the turn at the end of the 9th hole, you put it back on, okay? One time is not enough while you're out there. Use water-resistant products if you're going to be sweating or in the water, okay? And what they have to say on the label now, they can no longer say waterproof. The FDA said, nothing's waterproof. They can say water-resistant for 40 minutes or water-resistant for 80 minutes. That's it. Use sun protective clothing, okay? If you've got on SPF 30, but you are sitting on the beach at noon, that's not going to be enough. Seek shade. Wear, sun protective clothing. I always swim in a swim shirt. Long sleeves are even better. They have them at Old Navy now. You don't have to spend a lot of money to get a cute little shirt that has sun protection in it. Hats, sunglasses. Avoid the outdoors when you can between 10 and 2. That's a good time to come inside. It's too hot anyway. Okay? Do your outdoors activities before 10 or after 2 when you can. Australia, this is from Australia. Unfortunately, I didn't take this picture. I've never been to Australia. They have a very high rate of melanoma, but they are starting to see it go down because they do great sun protection. And what they're telling you here, sun protective clothing, hats and sunglasses, SPF, I would say higher than 30. Avoid between 10 and 2. Seek shade, okay? And so they're ahead of us. What are these? I just got a couple. Warts. You're a great dermatologist. This is my least favorite thing to see in clinic, so if you have them, I've got another name in town that I'm going to send you to. Just because these are so, you can't believe how hard these are to get rid of. They are so hard. It's a viral infection. They are contagious. They are so hard to get rid of. Start with over-the-counter salicylic acid. You got to use it every day for 6 weeks to get an 85% cure, okay? So these are hard to get rid of. What is this? This is a staph infection of the skin, cutaneous staph. And what does everybody come in and tell me they have? I have a spider bite. That's all I have to hear. If you come to my office and you tell me you have a spider bite, you have the staph infection until proven otherwise. And so what I will do to this is numb it up, drain the pus, swab it, send a culture to the lab, and I'll wait a few days, and then I'll get your staph report back, and we will treat you with an antibiotic. Actually, we'll treat you with the antibiotic while we wait, because infections like this hurt, okay? If you have cellulitis, if you have a staph infection, the #1 sign is pain. You would touch this thing, and it would nearly send somebody to the ceiling. This is staph. This is a spider bite. Okay? This is a brown recluse bite. We talk about these having the red, white, and blue signs. It kills the skin in the middle. This isn't, sorry, this is a rough picture too. By the way, I think these are fabulous. But that's because this is what I do for a living. It totally kills the skin in the middle. And then you get white around it, and then you can get the red or the blue on the outside. And here's your guy. He's got the fiddle on his back. You see him? See the fiddle up there? So that's a brown recluse. Most spider bites are not going to cause the skin to die in the middle, but the recluse will. That's what they do. This is a type of alopecia. So another thing that we do in clinic is hair loss. This is tricky. This is an autoimmune hair loss. This is an awful disease. This is vitiligo, also an autoimmune. In this particular case, the body's immune system has decided to get rid of color in the skin. And this is something that Caucasian skin people can deal with pretty easily, because the number one thing we tell them to do is do not get a tan, because then it won't show up as much. But people who have darker skin type to begin with, this is really, really disfiguring, okay? And that's what Michael Jackson had, by the way. So there is truth. If you hear that, people who have this can choose, because there's not a way for us to get the color back most of the time. They can choose to chemically depigment their skin. And so there is something you can rub on, actually, that will take that pigment out. Unfortunately, it takes it out permanently. And so, but sometimes that's an option for people who at least want their skin tone to all be one color so that they don't look so blotchy. And I believe that is it. So thank you so much for your attention. You all have honorary dermatology degrees.